How to manage common frequency disorder in children? Frequent urination is a big issue in children, especially under 5. So commonest cause over here is the overactive bladder. So basically, it is a diurnal high arch disorders, and then your small bladder at times. So not always. Here, the bladder musculature contraction, the detrusor contraction is unknown reason. It's very high. So there have frequent urination, and in at times, if child cannot urinate, he has incontinence. There can be urgency, and these children frequently have anorexia and constipation. So, in attempt to stop this frequency, they endeavor like your holding maneuvers. They try, and the bladder is in a little bit of small in urodynamic study and the ultrasound. And if you do the urodynamic study, it shows the muscular contractility and your thick muscles of the urinary bladder. So functionally, small bladder anatomically may not be that small. So it's important to manage these cases by timed wording, 1 to 2 hour interval, urination, complete urination, double wording, so that the child doesn't keep any urine in the bladder. And at times the anticholinergics are useful, and oxybutynin and then tolterodine. They are recommended by FDA and America. These two are being used. In other country, we can use this solifenacin, mirabegron, and other anticholinergics. So Kegel exercise, the biofeedback, every day 1 hour session. Contraction, basically it is contraction of the pelvic floor muscles, and 8 to 10 times in a day is useful at times to retain, to avoid the frequency and to avoid the anorexia. At the end of the journey, these children they grow out of the problem most of the time. At times not, adult can have these things, and so it resolves at good amount of time. The other one is pollakiuria. Pollakiuria means the frequent voiding. This is a Greek word, means often. Polla means often, and curia means urination. And child voids over here is quite high frequency, 5 to 10 minutes interval, and the bladder and the urodynamic, everything is normal, no UTI business. So overactive bladder can have little bit of UTI at times, but in pollakiuria usually do not have an UTI. And when he sleeps or she sleeps, she doesn't do these things. So it is a daytime frequency, little bit psychological sort of things. So treatment over here is counseling only. Needs no anticholinergic and medications. They are not useful over here. So it resolves good amount of time with age. UTI, dysuria frequency, urgency, tender, lower abdomen, the loin pain, fever can have frequency at times. So do one urine culture, and then maybe concomitant obstructive uropathy. So one ultrasound, KOB and PBF may be needed in diagnosis of UTI and UTI with frequency.